Hello viewers, this is your primary or preventive healthcare advocate Bernard Agbonoshi. You can simply call me Bernardis. I am the author of the public-friendly medical book titled The Role of Public Medical Knowledge in Disease Prevention and Treatment. I am also the founder and the director of the health organization Bernardis Preventive Health Education. Our second disease topic, which is the current disease topic, is sickle cell disease. This is my second presentation on the topic. So for you to understand this current presentation on sickle cell disease, you need to watch my previous presentation on the disease. Because in the previous presentation, we look at the medical explanation of sickle cell disease. We look at how the disease occurs. We look at genetics or hereditary in connection with sickle cell disease. So for you to really understand the current topic on the sickle cell disease and the subsequent ones, I encourage you to visit my page at Bernardis Primary Healthcare Media on Facebook and watch my previous presentation on the topic. It will go a long way to help you. I always say, you may have knowledge on, let me say, how plane or aeroplane is operated. You may learn how the pilot flies the plane, but you may not really end up using that knowledge you have on aeroplane. It may not benefit you in any way. You may brag about it. I know what goes into the work of the pilot, but that knowledge may never be put to use, or that knowledge may not directly benefit you in any way. When we come to medical knowledge, it is a kind of knowledge that even though you are not a medical practitioner, you are not a medical scientist, or you are not a doctor or a health worker or a nurse, that knowledge can directly benefit you, the individual. So it doesn't really only earn you the bragging rights where you are not a health personnel, but you can really tell someone what a particular medical topic is. It's not only the bragging rights that you have, but you also have knowledge that you can directly use to benefit yourself or others around you. So let us not assume medical knowledge or having knowledge on disease topic is the job of health professionals, doctors and nurses. Our greatest benefit as health professionals is not only our salaries that we are entitled to. One of our biggest benefits as health professionals is that we have knowledge on diseases. We have not really suffered the disease before, but we have adequate knowledge on the disease, the working of the disease, how to prevent the disease, how to manage or treat the disease. So we use that knowledge to prevent disease because we are not actually we are not out of the reach of sicknesses. We are not immune to sicknesses. We are human as everyone else, but the only difference is that we have adequate knowledge on how to prevent diseases or how to manage diseases. And that is one of the greatest benefits that we have. That is the reason why when a health professional is sick, a doctor is sick, or a nurse is sick, you hear someone say, "Oh, so Papa nurse, uso yare, mami nurse, inti mami nurse so yare. Hey, Papa doctor so yare," as if the health professionals are some kind of superhuman beings. But the reason is obvious. We know better, so we can actually help prevent a lot of diseases from affecting us. So don't renege on seeking to have basic knowledge on health. It will help you a lot. It will help those around you. People who suffer stroke, the signs and symptoms of the development of stroke gives sometimes pre-warning. The signs and symptoms of very high BP, hypertension in a dangerous state are there. But because the person has no knowledge on how this thing evolves, how it happens, the person took it as anything normal. I mean, it's normal. He's having headache. Just go and get paracetamol and then he's fine. He wants to get up and then the hand is shaking. I mean, his gait is not stable. It's on and off. These are all signs that the person is about getting stroke. And I hear people tell me, oh, I thought it was old age. When he gets up, then he's shaking. So I thought it was old age. I never knew it was actually stroke that was about to happen to my father or my mom. So this is the importance of we, the ordinary citizens or the public, having basic knowledge on diseases. Let us not leave it in the hands of only health professionals. We, the public, can have it and use it to our own advantage. Let's continue from where I left off in our previous presentation. In the previous presentation, the last point we looked at was the two major problems that sickle cell patients face, and they are the sickle cell crisis and anemia in sickle cell. I explained what the sickle cell crisis is, and I also explained the anemia in sickle cell. So it will be good when you actually watch the previous presentation before watching the next one. That will help you build your understanding as we move on with the topic. I would like to make this point also that we cannot prevent the crisis. The sickle cell crisis cannot be prevented, but it can be mitigated. It can be, the chances of the crisis happening can be reduced. And also the conditions that normally precipitate the crisis cannot be pinpointed. You cannot actually single out a factor or factors as the cause of the crisis. So the factors could be 2, 3 or more factors that actually work to get the person into the crisis. These are some of the conditions or factors that trigger sickle cell crisis. We have sudden change in temperature, and this is usually cold weather. When a person is exposed to cold condition or atmosphere, the blood vessel, that is the vein and the arteries, reduce in size. And we have learned that already the red blood cells of the sickle cell patient have a shape. The red blood cell has a shape which makes it difficult for it to smoothly flow through blood vessel. That is, the red blood cell of the sickle cell patient has an S shape instead of round or concave shape, or it has a shape that looks like the farm tool sickle, which is used for harvesting fruit. So this shape of the red blood cell already makes it difficult for it to flow smoothly through blood vessels, the veins and the artery, which has not changed its shape. So if the blood vessel, which already does not allow the change shape of the red blood cell to flow through, it's reducing in size, that is going to compound the situation, or that is going to make blood flow more difficult, hence causing the crisis that they go through. Another factor that can trigger the sickle cell crisis is dehydration. Dehydration can trigger the crisis because Due to the deformed shape of the red blood cell, making it difficult to smoothly flow through the blood vessels, blood flow is sluggish. Blood flow is sometimes sluggish. Hence, the blood of the sickle cell patient can become viscous, can become thick, instead of having its form that easily allow it to move freely through the blood vessels. So when the person is dehydrated, the person does not have enough fluid within the body, the viscosity or the blood becomes more thick. Hence, its flow also becomes more difficult, and that can trigger the crisis in the patients. Other factors that can trigger the crisis include smoking, taking in alcohol, abuse of certain drugs. They can trigger the crisis in the patient. We also have stress. It could be physical stress or psychological stress. Another factor is pregnancy. Yes, pregnancy can induce crisis in a sickle cell patient. In a hospital, I observed that the factor that triggers the worst form of the crisis in the patient is infection. Yes, infection is actually one factor that contributes to the death of patients who have sickle cell disease. It can be any form of infection. It can be pneumonia, it can be malaria, it can also be any kind of abdominal infection. Most of the time, they delay at home. They don't normally come to the hospital early or on time for these infections to be treated. And once that happens, it creates the situation for the crisis to occur, and it gets worse. And sometimes it's too late before they reach the hospital. So most of the patients that die as a result of the sickle cell crisis actually had some form of infection that was not treated early, or that was very difficult to treat. One of the major problems that sickle cell patients normally face is anemia. Anemia is simply low hemoglobin or HB level. Or in simple terms, the ordinary person will say the person has low blood volume. In a local dialect, this is what they normally say in the hospital. You see onimoja, which literally means the person or the patient doesn't have blood or doesn't have enough blood. But anemia is simply having low hemoglobin level. Hemoglobin, we've talked about it in detail in the first presentation. It is the cause, hemoglobin, that it is defect in a gene called hemoglobin that results in the problems that sickle cell patients face. So hemoglobin is a very important component of blood. It is a very important component of red blood cell, which carries what? Oxygen to all parts of the body. The body is actually made up of cells, and cells are living things, tissues. So the tissues, the cells of the body actually need this oxygen to survive, and it is hemoglobin that carries this oxygen. So if it is low, if it is not enough, that is going to cause a major problem in the body, and that is one of the main problems that sickle cell patients normally face. We have range of values for hemoglobin level. Men and women do not have, adult men and women, healthy adult men and women do not have the same hemoglobin level. The normal hemoglobin level for adult men ranges from 13.5 to 17.5, and that for women ranges from 12.0 to 15.5. So people who have sickle cell disease, they have hemoglobin level way lower than what we have stated as normal for both men and women. So you can meet someone who is anemic. It's not only sickle cell patients that can be anemic. People with other disease conditions can also be anemic. So if someone is anemic, or the person is having anemia, the HB level is normally below 10, below 10. The person will be having HB level of 9, HB level of 8, 6, and that is very dangerous. The lower the value gets, the more dangerous it becomes, because the person's cells and tissues will not have access to the important oxygen that they get, which is bed, or which is born, or which is carried by the hemoglobin. I would like to add that sickle cell patients normally have very low HB level, or are normally anemic, and this is due to the fact that the deformed red blood cells break down earlier than expected. Red blood cells have normal lifespan of 120 days, but in the sickle cell patients, the red blood cells break down way earlier than that 120 days. And once more red blood cells are being broken down than it is being produced, it will definitely result in its deficiency, and that normally brings about the low HB or the anemia that we often see in sickle cell patients. So what I'm trying to say basically is that the deformed red blood cells break down easily and earlier than it is being produced. So more red blood cells are being broken down or are being destroyed than it is being produced to replace the broken down red blood cells. Once that happens, obviously deficiency of it will result, and that brings about the anemia. Anemia comes along with very serious signs and symptoms. One typical one is difficulty in breathing, and this is due to the fact that oxygen is not being made available for internal respiration. The cells and tissues are not having adequate oxygen for respiration, and that is carried by the hemoglobin, which is low. So a person may be in a room where there is so much air, fresh air, but the person will still be having difficulty in breathing. The reason is the air that you breathe into your lung externally from the external environment is not the same as the air that the cells need. It has to go through a lot of changes or process for the cells to be able to use them. So a person may be in a room. It's not that the person is in an enclosed area where air is not coming into that space, but the person might be taking in air externally. External gaseous exchange could be taking place, but the person will still be having difficulty in breathing. And when you go to the hospital, when a person is severely anemic, the person doesn't have enough blood, as the simple man will say, and you put the person on oxygen, the person will still be having difficulty in breathing. The person will still be struggling to breathe, just because the air being pumped into the person externally from the oxygen tank into the lung is not made available in a form for the body cells to use. And once that happens, it will surely result in the cells being deprived of very important oxygen, and that will definitely result in the struggle to breathe, even though you put the person on oxygen. When a person is having difficulty in breathing as a result of anemia, the best solution is not to connect the person to oxygen. The best solution is to raise the hemoglobin level and that is done through blood transfusion. Yes, so those of us who feel so reluctant to take blood or to be transfused or to receive blood, take notice. When you are severely anemic, the best solution to that is blood transfusion. And severe anemia can kill within the shortest possible time. When your body cells, tissues are denied of oxygen, it can kill the person in no time when nothing is done about it. So those of us, for one reason or the other, refuse to get transfused. This is the danger that you might be exposing yourself to or your loved one to when you refuse such a solution. Another sign or symptom of anemia in sickle cell patient is jaundice, and this is shown as yellow colorization of the eye. It can also be shown in other parts of the body, especially with babies. And jaundice, or that yellow colorization of the eye or the skin, occurs as a result of excessive breakdown of red blood cells. And remember, we made mention that due to the defect nature of the red blood cells in the sickle cell patient, they tend to break down or get destroyed earlier than the time that it is expected, which is within 120 days. So when the red blood cells are broken down excessively like that, it results in jaundice. So jaundice is simply that yellow colorization of the skin or the eye as a result of excessive breakdown of red blood cells. Another sign or symptom is general body weakness. The person could also feel easily irritated. So these are some of the signs and symptoms of anemia. When you go to the hospital and the health professionals tell you you are anemic or you don't have enough blood, please don't take it lightly. When you are told your HB level is low or your blood level is low, you might not be having all these signs and symptoms that we mentioned. You might not be having the difficulty in breathing at that point of your HB. But when you refuse to take precautionary measures, when you refuse to take some remedy measures to correct the low HB, and then you go home, you might end up getting the signs and symptoms at home at a time that it will be so serious that when you are not brought to the hospital early, you could end up being in a very bad state of no return. There are many other serious health problems that sickle cell patients might face. In males, they may experience what we call priapism. Priapism is having an erection for a very long time, which is not even provoked by sexual arousal. So the patients might just have erection for a very long time when it is not because the person is sexually aroused, and that can be very painful. The fact is, hemoglobin is needed in all parts of the body. All body tissues, cells, organs need this hemoglobin very well. And when it is deficient, when it is not enough, it virtually brings about serious health problems to the individual. And sickle cell patients have this problem with hemoglobin, and hence they are exposed to a whole lot of serious medical problems. Now let's look at how we can help manage sickle cell disease as individuals. As I said earlier, the two major problems of sickle cell disease are sickle cell anemia and sickle cell crisis. So how can we help manage sickle cell crisis, or how can we help mitigate the occurrence of sickle cell crisis or anemia? As I said earlier also, we cannot prevent sickle cell crisis. We can't completely prevent or stop sickle cell crisis, but there are a lot of things we can do to mitigate the effect of the crisis, or even reduce the chances of the occurrence of the sickle cell crisis or even the anemia. Earlier on, we look at some conditions or factors that easily trigger sickle cell crisis or anemia. So if we can do something about those conditions or factors, then we are on course of making sickle cell disease less of a problem. One that we look at was sudden change in temperature. Yes, so to mitigate the risk of getting the crisis, make sure you don't expose yourself to cold weather. Always make sure there is warm. You provide warm for your body. Don't find yourself in very hot condition also. That will also trigger the crisis. So just make sure you find yourself providing very warm condition or environment for your body in order not to trigger the crisis. So sickle cell patients should not sit under fan for a very long time. They should also not be taking cold drink or water. Whatever they take in should be warm, and that is better. Another one is stressful or vigorous activities. So sickle cell patients should not engage in any form of activities that puts so much pressure or stress on them. This is because when they engage in such vigorous activities such as intense exercising or working in a very stressful environment, it limits oxygen level in the body system. And when oxygen level in the body system is limited, it can trigger the red blood cells to assume the S shape. It can trigger the red blood cells to take on the deformed S or sickle shape. And when the red blood cells assume this shape, flowing through the blood vessels will be very difficult. When the red blood cells assume this deformed S or sickle shape, it becomes more difficult for the blood to flow through the blood vessels, or the deformed blood cells get stuck to the walls of the blood vessels, impeding the smooth flow of it. And once that happens, the body parts, key body parts, will not have access to sufficient oxygen, and that brings about the crisis, the pain that they normally face. So they should limit their activities level. They should not engage in very stressful activities. Their activities, physical activities, should be moderate. They should try as much as possible to limit stressful situations or activities in order to avoid the crisis or to reduce the chances of the crisis occurring. Taking in certain drugs is an example. So sickle cell patients should avoid self-medication. They should always make sure drugs they take is prescribed by the health professional. They should not take drugs such as iron supplements. In fact, taking in so much iron supplement, having so much iron in the body system, can actually accumulate and cause serious damage to body organs. So sickle cell patients should avoid taking in iron supplement with the hope of having enough blood. That could rather be dangerous. So they should always take prescribed drug. If they have any concern about any drug, they should talk to a health professional or the doctor in order to be on the safer side. Another one too is dehydration. So sickle cell patients should drink enough water. They should not wait to be thirsty before they take in water. They should always make sure they are well hydrated. They take in fluid. It can be fluid diet. They should intentionally drink enough water. This is because, as said earlier, the blood can be thick. When the blood is thick, just because it is not flowing, just because its flow is being hindered, it can actually make it thick. And taking in enough water can reduce the thickness of the blood for it to flow smoothly to reach all parts of the body. Another way to help reduce the risk of the crisis or the anemia is for sickle cell patients to eat well. So to reduce the risk, make sure, or sickle cell patients should make sure they eat balanced diets. They should not be eating junk food, which will not in any way help the body system. They should eat food that will boost their blood level. They could also talk to a professional dietitian who will give them guideline food that they can eat to help boost their blood level. Infection, as said earlier, is one factor that can cause serious crisis in patients, in sickle cell patients. So sickle cell patients should not take lightly any form of infection. It can be malaria, pneumonia. They should make sure they treat infection on time. When they are feeling ill, when they are sick, they are exposed to some kind of infection such as malaria, they should make sure they treat it on time. What I'm saying basically is that sickle cell patients should treat infection promptly. They should never delay in treating any form of infection, because that can trigger a crisis in a very severe form. And I have seen, as I said earlier, I have seen such kind of infection putting the life of sickle cell patients on the line. So to avoid such dangerous and serious situations, sickle cell patients should always make sure they avoid all forms of infection. They should make sure they sleep in an environment devoid of mosquitoes to give them malaria, because they are prone to the disease malaria. And I would like to add that having high temperature or fever is a typical indication of infection. So if you are a sickle cell patient and you realize that, or you know someone who has sickle cell patient, and you realize that the person is running temperature, or you realize that the person is very warm to touch, or the person is having fever, kindly rush the person to the hospital for treatment, because infection, all forms of infection, can make a person to have fever or very high temperature. So sickle cell patients should treat infection with all the urgency on their side in order to avoid fatal situation. I would like to add that we don't have one strict guideline for treating or managing sickle cell disease. This is because sickle cell disease does not express itself the same in all sickle cell patients. That is why you can see someone who is having sickle cell disease, but you cannot tell. You will not really see clear features of sickle cell disease on the person, just because the disease or the deformity of the sickle cell disease does not express itself the same in everyone. There are some people, when you see them, immediately you know they have sickle cell disease, because the signs and symptoms are clear on the person. The person's body features are clear to tell you that this person is having sickle cell crisis. I have a number of friends who have sickle cell disease. They have genotype SS, but you can never tell from appearance that they have sickle cell disease. That is the reason for that. So we don't have the same guideline or treatment for managing sickle cell disease or treating sickle cell disease. It is treated based on the situation of the patient.